We've got a great group on the call, so I'll go ahead and get us started. I'm sure a few more folks will trickle on in as we are going. But good afternoon, everyone. Thank you all so much for being here today. This is the December Research Series presentation hosted by the Carolina Community Coalition. The coalition brings partners together across campus and the Columbia community to talk about and address issues related to high-risk student behavior that we're seeing. Over the past year and a half or so, drink spiking or involuntary drugging has become a more prevalent issue that's been coming up on our campus. Clemson University has been seeing some similar issues on their side of things, and in response, they were able to bring together partners to be able to offer green screens, a drug facilitated crime testing kit, to students on their campus. We've got a great group of speakers here today to talk about that, including Kelley Metcalfe, who is Associate Director for Alcohol and Other Drug Initiatives with Clemson Healthy Campus, Chief Campos of City of Clemson Police Department, Chief Harrington with Clemson University Police Department, Shannon Henry, President and founder of SASCO, which is Surviving Assault Standing Strong, Brett Brown, Executive Director of SASCO, and they'll be sharing with us what green screens are, how they were able to be able to offer them on their campus, and what that implementation process has looked like so far. And with that, I'll turn it over to y'all. Thank you so much for being here.
Thanks, Jenna. I also want to say too that we have Ellie Cahill with us from Fraternity and Sorority Life. So that is a huge partnership for us specifically at the university too. Um, do you want me to go ahead and pull my slides up? And then I think more conversation will probably come from that.
Yeah, that sounds good.
Okay. While I'm doing that too, I think that myself, Chief Harrington, Chief Campos, and Ellie too would say that this wouldn't be possible without just the amazing work that Sasco has done and created already. I mean, it was something that we were able to kind of easily work in and do with the support because of everything they're already doing. So while this looks very Clemson-y and ready, I do want to just acknowledge that all of their hard work makes it possible for us to serve our students in this way. So um, I can start us off with just some of the information here, and then I know you have a lot of questions too. So everyone on the Clemson end, I think whenever you would like to jump in, I think Ellie, you can give the like fraternity and sorority life information. And Jenna, you covered it a little bit what the green screen is, but here's a breakdown of it, and even a little snapshot from their website for a visual as well. And I linked it here so that if you'd like to share the PowerPoint, it's easily accessible. But this testing kit with this partnership with SLED and SASCO, it's going to pull the toxicology from like their blood and urine collection materials, the consent form, the chain of custody forms, and then just victim information and advocacy information. So this was really helpful for us too, with the way that Sasco helped tailor this to our area and our students, because originally the information was more Columbia focused, but they were really kind and helped us work on this for our area up here. So here's this kind of timeline breakdown. Ellie, if you want to kind of give the story of why we're even having these conversations.
Yeah, so I've been at Clemson now about 3 years, and these conversations really started from the moment I started working here. For context, I work as the Panhellenic advisor, so working with our large women's sororities here on campus. And you would find about every fall and spring, towards the beginning of the semester, there would be a lot of conversations around drink spiking on campus and women who, whether that was at off-campus fraternity events or bars that were downtown, felt as though their drinks were being tampered with and spiked, were having some really adverse reactions after nights out. But unfortunately, what we didn't always have was the resources to be able to support them and have them kind of find out what was actually going on. And so, we'd spent years doing things like my cup covers, my cup condoms, things like that we were passing out in kids on campus, talking about safe drinking and drink spiking and stuff. But those were just not things that were really landing with the women. They didn't want a scrunchie that they would put on their cup out at a bar, having to remember to do those things or anything like that. And so kind of felt like there wasn't a lot of success getting it like education out there to protect the women. And so it really started with the Panhellenic Council. One of the women, as her term was ending, they were like, something has got to give on this conversation. And so they started doing some research and found a different organization that offered drink spiking test kits. They were looking at everything from those like nail polish things that you see on like TikTok and social media to strips that you can put in your drinks or things like that. And so they found a company that they really did some research in, started meeting with them, and that organization gifted us test kits. And so we ended up tabling downtown. That's when we first got connected with both of the chiefs to connect with them about the programs. We could get the bars involved and what does that look like if they test their kit, or I guess test their drink at the time. What are the next steps? What do the bars do? What do the students do if they receive a positive test? And so during the Clemson and University of South Carolina game on the Friday night before the game, it was a Clemson home game. They had a tabling event outside where they had about 500 kits that they ended up passing out to all of the different women and educating and providing educational resources about what does drink spiking look like, what are the symptoms, how do you utilize this kit, and then what are your next steps if you test your drink and it comes back positive. And so it was a very hurried, rushed process at the beginning, but that's where the conversation started and where we really got the great opportunity to connect with the chiefs. And I want to give them all the credit in the world that they heard our women, they heard what they were struggling with and what they were scared of and how they felt, not only on campus, but off campus when they were attending these events. And Chief Campos really said, well, we'll find a solution. We'll find something better than this, and really jumped in, did the research. And that's when he kind of came back and said, hey, here's this green screen kit. I would love if we can utilize this. I think it's a better resource, and it also can work directly with our police departments. And so that's kind of where we jumped in on that.
Yeah, so here's kind of the breakdown of that timeline that we went through. And then for some reason, I feel like these are always on random timers. And then we did some photos, and I wanted to include those here to share just the way that this was a great way to bring all of these partners together across campus. So we have the Panhellenic Council members, we have both of the chiefs, myself and my director of Healthy Campus, and then our director of Student Health Services. So that was really fun in a way for the women in these positions to kind of partner with the leadership on campus, particularly with like Chief Harrington, and then also bringing in Chief Campos as well as this partner was really a unique thing that we haven't, I mean, correct me if I'm wrong, Chief Harrington, but this isn't anything that we've seen a partnership like this on campus this way. So that was really exciting to see that jump off. And I have a few more here too of the chiefs with all of the women, and then even just the kit itself is so wonderfully put together and so easy. The booklet that they created at SASCO is really informative and straight to the point. And then we actually also, it's not in this photo, but for Clemson University specifically, we created another sticker that we put on the front that has a QR code on it for our students. So this is not a resource that is limited to students. If anyone goes to the emergency departments in our area where the kits are, they believe they've been drugged, this is available to them. So we wanted to create a specific resource for students that kind of leads back into that follow-up information and resources that are available for our students. So some of the information throughout the rest of this, though, I think will answer some of the questions that you have. And then really we'd like to open it up for both of the chiefs and also the leaders from SASCO to talk with you as well. But we kind of noticed these trends, like Ellie mentioned, that are similar to what y'all are experiencing. But there's also so many things to take into account here. So the time frame in which this has happened and getting tested in that right like that little window, whatever it may be. And if it's not, then the evidence is gone, or maybe it's not the right test that they are asking for. So this really kind of was allowing the space for that to be corrected. Overall, though, the green screen gives us a lot more accessibility for our students to look into these resources, to have the support from law enforcement as well as the university if they really do feel that they've been a victim of this crime. So, some of the things that we've noticed along the way that we'll touch on that Chief Campos, Chief Harrington jump in here as well, but something that we've had to point out and make others aware of is this does not replace the sexual assault kits that are within the hospital or through like the SANE program that you would see in South Carolina. So these two things are very different. Chief Campos, I see you unmuted. Go ahead.
Yeah, so I just wanted to jump in. We did, when we rolled this out, experience at least one case that I'm aware of where the acts that occurred would have fit a sexual assault under 16.3, 654 because or 652 because the actors and the victim had sex, and it was after the actor had provided copious amounts of alcohol to the victim. And so that would constitute under the law a sexual assault. And when the women came forward, it could have been reported as a sexual assault. Now, the women were very explicit in they did not want to go down a sexual assault road. They just wanted to know, had they gotten drugged? They did not want to go down a sexual assault investigation, which again, that's entirely up to the victim if they want to do that, and we'll honor their wishes when it comes to that. But it's just part of that conversation that we have with people, and I'll emphasize this at the beginning of every season. I know Chief Harrington and I talk to the football team. And this is something that I bring up with the football team about consent and when you can consensually engage in things like this and when you cannot, and when it's illegal and when it's legal. And just to emphasize that just because drinking and copious amounts of drinking may be involved in here, it's not going to alleviate you of the responsibility of ensuring that you have consent. And it just seems to be, unfortunately, something that we're dealing with in our society right now, especially in this age group. And it's not just this age group, it's the older folks as well. But I just want to make sure that people don't say, well, I'll just go get a green screen and then worry about the rest of it later, because there's so much evidence that needs to be collected in a sexual assault kit that's crucial to a successful prosecution of that case. It can't, and it's time sensitive as well. Even though the blood and urine sample kit in a sexual assault kit is the same as the one that's in the green screen kit, that's not the only evidence that we need. So I just want to make sure we emphasize this, especially if we, here in Clemson, we hadn't talked about this, but the students can go to the clinic on campus and have this kit taken. We want to make sure the providers at the clinic are having these discussions with these victims, potential victims, so that we're doing the correct analysis. And so I'm fearful that one will get used over the other when it should be the other way around.
Yeah,
Yeah,
absolutely. Oh, go ahead,
yeah,
Chief.
yeah. I was just going to say, I mean, to Chief Campus's point, and that's been a real focus for both of us throughout the course of this project rollout is making sure that we continue to reiterate the difference between the two um, incident types and the two potential investigation types, because we absolutely do not want a situation that really should be investigated as criminal sexual conduct or sexual assault to kind of fall through the cracks because somebody mistakes the idea of what a green screen is versus what its intent really is designed for. And so that's really important. So I would just highlight that the communication not only to providers, the communication to providers is extremely important there. In our work with Prisma, particularly over at the Oconee Hospital, which was the first site we rolled this out to outside of Clemson Student Health Services, That was part of their feedback too, was just making sure that there was good instructional information for their own staff to be able to be very clear on this is not a replacement at all. This isn't even a companion or a side by side to a sexual assault examination. Sexual assault kit will encompass this same type of evidence collection and the ability to do lab processing on that. So this would simply be for a non-sexual assault report where a tampering or a drink spiking or a food spiking is suspected.
And I'd like to add, if it's all right, thank you for saying that because it's hugely important, especially that providers know the difference between the two. And without checking with Shannon, I think I can add this. You know, there's directions in the green screen kit for providers, just in case we end up with somebody who's unfamiliar with the process. I think it would be a very simple step to add to that to basically help then differentiate in between the two of that if sexual assault is suspected, you know, this is another option and why that's important. So this feedback I think is really helpful, and we can actually improve upon what already exists to make that process more smooth and to make sure that students get what they need to preserve their options later, since they don't really know what they want to do yet. That's it.
Yeah, and we put together. Well, I say we put together. Kelley really kind of put together, and then Chief Campos and I just kind of gave it the once over and added a couple of notes. But she put together a one pager for that exact purpose, to be able to give to providers to provide some really handy clarification for them, so that nobody in the moment had to go flipping through a booklet, right, and trying to figure out where that information was.
That's awesome.
Yeah, I have that one pager for us to either look at or I can send out as well because it was something that the communication with I ended up actually connected with the essentially nursing training supervisor. So she was the person that was pushing it out at Oconee Memorial Emergency Department, and she was like, okay, what can I like, how can I train my staff? But then how can I also keep something in there for a fast reminder because they've gone through the training, but maybe they haven't used it in a month. So they're like, wait, what are these tips or what are the main points that I need to take away? So we created this one pager that I'll show you that really, I feel like I typed it, but the Chiefs helped me make sure that the right points were there so that they were doing it correctly to make sure that y'all's kits were used in the ways that were effective for people that were seeking this assistance. So that was really helpful. And I think it's something that they physically have, but then she, specifically at Oconee Memorial, she put it in, she's letting it live in their training information so that it is something that maybe they can't find that specific printout. They can go back and just pull that PDF that I sent her that also gives extra information.
That's awesome. That's really awesome.
That is wonderful.
That's been really helpful. And I think building those relationships has really been what helps this. I know I said in the beginning that like we really haven't had a collaboration like this. And that's not just at the university, but that's across the board, like with SASS-GO and then with Prisma as well. It's been unique and really cool to see everybody come together. But going back kind of to the basics and pulling the rest of this, so the reporting and initial response, we have kind of the breakdown. So what is that first point of contact? Is it police? Is it an RCMs, what we call them here? So I put in parentheses RA just in case South Carolina. I'm not sure what y'all refer to your RAs as, but we've transitioned to RCM. So I wanted to make sure that made sense. Or is it medical staff? Is it faculty? Are they just going straight to Redfern, our health center? So whoever that is, that first point of contact, and then making sure that they're informed on their options because what we're finding is we're having to make sure students are understanding that this is filing a police report and making sure that they're aware of that and how to go through the process as well. So from the student perspective, there's that, but then the providers also understanding, waiting for law enforcement because we want to make sure that we have chain of custody in line and that everything's going to hold up essentially in court later on down the road if it gets to that point is how we've walked through that as well. Also, I think there's a timer on here, guys. I'm so sorry. I don't know how to make that not do that. But this is kind of how we've walked through this and given this basic information. And again, I have that one pager, but then I went ahead and we broke down too. So these timelines, are really important. So we have them separated in how they are, essentially like 2 days to 5 days. It's helpful for students to hear. For the medical side of thing, they understand this a lot better than I do, and they can walk through it. And they're like, okay, this makes complete sense to me. But for students, we kind of say, when specifically if I'm educating, or Ellie, if you're having these conversations, I always try to say like 2 to 5 days, depending on, because that helps them. Because you say 120 hours. I mean, you say it to me, and I don't really know what that means, let alone a student in distress or things of that nature as well. So we like to encourage that. And Chief Campos mentioned this a little bit, but I think having the knowledge of the timeframes is important as well, because specifically for us and the university connection, if a student goes to the emergency department and they do this, the way that pricing breaks down is the test itself is covered through SLED if they go this route, but then part of that will be their visit will be billed through their insurance. But if they're a student and they're within this time frame, they can wait. If they go at 2 a.m. to the emergency department, they can go home if they're within this time frame and go to Redfern at 8 a.m. the next morning if they're still within these hours, and go request the kit. And the kit itself is covered through SLED, but then they're also not going to have a fee because they are utilizing the services that are available to them as students at our health center. So that has been helpful as well for that one pager and emergency room staff to be aware of as well.
Can I make a quick comment
Sure.
regarding that? I'm Dustin Smith. I am the supervisor at SLED and toxicology. And I do want to say that while that may be potentially an option, I would not encourage students to not go immediately to the hospital. While there is a possibility of detecting drug up to 48 hours in blood and up to 120 hours in urine, it's highly unlikely, frankly, that we're going to see drug out that far. Our testing parameters actually are routine. We only test out to 24 hours in blood and only out to 72 hours in urine, unless there's a specific reason why we should test longer than that. And the reason for that is that the opportunity for us to actually detect a drug that was associated with a particular event out at these times is very, very, very low. So the sooner that the student can report to the hospital and have the samples collected, the better opportunity that we'll have to detect the drug, and also the better opportunity that law enforcement will have to be able to relate the drug to the actual incident, and not call question into whether or not the drug was ingested after the incident, and have nothing to do with the incident at all. So I just wanted to point that out there. While it's, I would not encourage them if they really believe that they have been drugged. I would encourage them to go as fast as they possibly can to have those samples collected, regardless of what cost they may incur. Because the longer that you wait, even 4, 5, 6 hours, could result in those drugs being metabolized and eliminated from the system, at least to an extent that they're below our reporting thresholds. So I would advise for them to get there as quickly as possible.
Sure. Yeah. Sorry. I hope that didn't come across either as we're deterring students from going at all. I think it also is helpful for, and Chief Campos, you and I have talked about this a little bit, just like when differentiating between are they a victim of a crime, or are they kind of figuring out what they've walked through at that night as well. And we can talk more about that too. But thank you for pointing that out. I think that's good information to know and helpful to for us to know, to be aware of for kind of testing in general.
I think too, I'll say that these timeframes are also a way of our officers knowing that it's been too long
Mm-hmm.
to even go through this process. It's not worth evidentiary reasoning to go beyond these timeframes. And so when they do come in, because we'll get people to come to us sometimes 3, 4, 5 days later
Yeah.
and say they got drugged, and then say, well, it's the time has lapsed for us to analyze your blood. A lot of times we'll get parents that will call also wanting to know a time frame. So I agree with encouraging them to go as quickly as possible. And I think that's our advice to them. But while they're still milling it around in their head, unfortunately, for whatever reason, there's a pause before they come forward.
I think too, and we'll talk about kind of with the partners on campus, it's also helpful from a university's perspective with conduct, and them and students, sorry to say them, for students to say, in the conduct process, oh, well, I think this happened and I need a green screen. That's usually weeks after the fact, and being able to direct them in the right direction to say, well, that's not an option anymore, is also helpful with these timelines as well. Um, so different things for law enforcement too, and this kind of covers with the one pager, but we have law enforcement. There's the way that SASCO's made these little booklets. There's essentially all the consent forms they need are in there, and it goes through law enforcement signs and the student or patient would as well. So it's helpful for them to have everything they need there, and it keeps everything kind of in check to be sure that evidence is, again, usable in court if it were to go to that point as well. So they remain present for these things, and then they're transferred to SLED in the proper chain of custody. I don't know, Chiefs, if either of you would like to touch on that.
Yeah, I mean, I think that it's important when anytime you bring in a new process, even though this sample collection kit is not new at all to anybody who's been in law enforcement for a little bit, because this same sample collection kit's used for a few different purposes. But you introduce a new process, and then that tends to take a little bit of time for folks to understand what's the same, what's different. And so these instructions are as much a helpful reminder to the police officer when they're going. Even though I know the city's pushed out information to their staff on this, we've given instruction and information to our staff on this so that they understand this is really the same process. You need to treat this like you're collecting a sample for, say, a felony DUI investigation, or you're there collecting a chain of custody sample, or receiving a SANE kit, for chain of custody in sexual assault investigation. Like, that's how you need to be treating this. This isn't just show up and write down some stuff, take a report, and then you're just going to bring something back with you later. You need to treat this like you are conducting an investigation from the moment you get there.
Yeah, so then from that's like police perspective and kind of provider, but also the general kind of healthcare providers and their responsibilities and kind of how they walked through that. Again, that one pager goes through a lot of that as well, but just kind of the differences in what we're walking through. And we have talked too about just the like trauma-informed care and how we're communicating with patients throughout all of this, which for them is nothing new, and it's just kind of more of a reminder as they're walking through this process with the student or the patient as well. So this is more, some of these are a little more university focused as well, but you can see just kind of the different roles here. So SASCO, in that booklet, they provide kind of the advocacy information for this area. There's if you do go to the hospital, but maybe you don't have insurance, there's ways that they can help connect for billing support. There are different ways that they can kind of advocate for, the person through this process. And then we also give a lot of information for our counseling and psychological services on campus and our care network or advocacy of success and kind of academic accommodations or follow-up support. And then Title IX is often brought up in this conversation as well, even though we've talked very much so about how like the difference with if sexual assault is involved or not, but just kind of having that there for students. And then kind of our role because I'm housed in student affairs and Ellie is as well, but just like our administrative, but training staff and keeping things consistent across the board when we are educating students versus faculty and staff, and the Redfern employees as well, and having like, for example, Chief Harrington and Chief Campos coming in and educating the Redfern staff was very helpful for them to walk through and really understand the process from their perspective, because they're not doing these kits regularly, whereas the emergency department maybe sees them a little bit more. Um, We've talked about this a little bit too, but just kind of the testing cost. So that is covered with the green screen through the SLED testing. The visit itself is billed to insurance if they do have insurance. And then again, if they are a student and they go to the student health center, which I don't know what y'all refer to that as in at Carolina, but whatever that is as well, however that pricing works. We did talk about, so my graduate assistant and I were talking through this and just some different challenges. Go ahead,
Ellie,
Chief.
can I jump in for a second?
Yeah.
So a couple of times we get this question a lot too, and there the perception of the public is when they go to the hospital and they ask to be tested for these substances, that the hospital has the laboratories and capabilities of detecting these substances. They do to an extent, and if there's anybody from healthcare on the line, you could probably test uh, speak to this better than me. And I know Dustin from our state lab is on, and he could talk about it. But the type of testing that our lab is doing is much more than what the hospitals are doing, and they're putting it in a format that can be used as evidence in court, where the hospital does not. And the hospital is doing diagnoses for treatment, for medical treatment, and that's for the purposes for their testing. Uh, an example I would use in a hospital environment where you're looking for something that may be evidentiary, unfortunately, is pathology after somebody has died and they're doing an autopsy or something and they're collecting samples, which is probably going to get sent to a lab like SLED to do the analysis for that purpose and not for medical treatment purposes. So a lot of our citizens are under this false pretense that they can go to hospital, have tests, and that way they can keep it to themselves and all that. But if they ever want to move forward with any kind of prosecution, well, it's going to be problematic in a court case to present that testing and whatever those results are, and how we can even testify as to how valuable that evidence is in the case. So I just wanted to emphasize that because some folks trying to, are apprehensive in getting the police involved because they're afraid of public exposure, and now, people outside of the family unit knowing about it, et cetera, et cetera. And this was some of the things that we dealt with early on before we had these kits available to us. So I just wanted to emphasize that. Thank you.
Yeah, if I can follow up briefly with that, that's correct, Chief Campos. The testing that's done at the hospital is very limited in scope. They have a very specific suite of screens that they perform, and that is primarily for treatment purposes to try to determine what the best way to treat an individual is. It is not forensic testing. It is a screen, and any screen has the possibility of having a false positive screen or a false negative screen. The testing that's done here is forensic testing. We must have two tests in order to report anything positive. And so everything that comes here both goes through a screen, and then it also then goes on for confirmatory testing and is forensically reliable at that point. The other big difference is that our thresholds are significantly different. And because of the time frame that often occurs between criminal sexual conduct, a drug facilitated sexual assault, and the reporting of the case, it's oftentimes that there's just a trace of the drug left. And the thresholds used by hospitals are intentionally set relatively high so that they only are able to address drugs that may be potentially affecting the individual at the time, so that they can treat them properly. So that's absolutely correct. Our testing is forensically reliable. We can come and testify to it. If we report that it's there, it is definitively there. And we also have the threshold set to where we can see it out as far as we possibly can to try to relate the positive findings back to the incident.
I think that's really helpful, and I actually really appreciate that language of this is not exactly what you said, but this is my way of putting what you said, that the hospitals are testing to for treating a patient. I think that that is helpful for verbiage with students, from my perspective at least, because I get that question a lot of, well, what makes this any different from if the hospital took anything? So I really appreciate that, how you said that. I wrote that down actually so that I can be sure that that's how we're communicating too, from our perspective, to students.
And Kelley, just to add to that, Dustin, if you wouldn't mind, would you let everyone know about how many drugs you're able to test for now? Because I know it's different from when we first started.
Sure. So we do testing in blood and or urine depending on the time frame and the scenario of the case. Currently for urine testing, obviously we start with alcohol testing, and I would encourage, and I know that this is not a surprise to anyone, but alcohol is far and away the most common drug of concern that we see in drug facilitated sexual assault cases. And I think our time, I have two kids in college, I think our time would be spent wisely addressing underage drinking, because I think that is a huge portion of, unfortunately, the drug facilitated sexual assault cases that we see. But for urine cases, we test for alcohol. Then we do a 21 panel drug screen where we look for 21 different drugs or classes of drugs. And then we also do what we call a general screen, which looks for an additional 100 or so potentially impairing drugs. And then we also do GHB testing on all DFSA cases in urine. In blood, we use a slightly different technology. We use a screening method called liquid chromatography quadrupole time of flight. And that screening technology looks for approximately 350 specific drugs. We also do alcohol testing, and we also do GHB testing if it is warranted. So while the hospital may only be looking for 6 to 8 drugs, we're looking for roughly 250 or so drugs in urine, 350 or so drugs in blood. And again, our screening thresholds and reporting thresholds are on average 5 to 10 times lower than what they would be in a hospital setting. And we provide confirmatory testing, whereas the hospital only reports a positive screen.
Thank you, Dustin.
Yeah, that was great too. Thank you so much. So some of the challenges from our point of view, in student health services, or just, I guess, at Clemson sometimes, are students are unsure about whether or not to involve police. And I would love for both the chiefs to talk about this a little bit too, because they are nervous if they, for instance, have maybe consumed alcohol underage or things of that nature. They don't really know. They're worried about getting in trouble, or they're just not quite sure. So they maybe don't want to do this. Some other things just that we've talked about too, but like maybe their providers are unaware about when to involve law enforcement or things of that nature. But I'd love for Chief Harrington, Chief Campos, for y'all to talk about really the intent behind this, and kind of why we have it, but also what's realistic and what's actually going on when students are, for students specifically, are coming forward about this.
Well, I'll chime in. There is a trust issue there amongst the students, because a lot of the people who are the students that are reporting this, and it's not just students, it's people in the same age demographic, are not old enough to be drinking. So their immediate fears are that they're afraid that they're going to get in trouble from us for being underage and consuming alcohol. But I think they're more fearful of their parents finding out, and not necessarily that they were consuming alcohol or something else, but that they were doing whatever it was they were doing, because parents are going to be much more inquisitive about what the activity that was going on around the time frame that this happened to them than we are, unless and I think they're more concerned about the parents finding out than us, for obvious reasons. So they don't want us to get involved for those reasons. But it's very much like, and I tell my staff this, we've got better things to do tend to go after somebody for underage drinking who thinks that they got drugged. I'm more concerned about determining who, if you did get drugged, who drugged you and why, because that's a greater health concern to us than going after them. And if we don't find anything in their system but alcohol, we're not going to come after them. I can, Thursday, Friday, and Saturday night, I go downtown and get all the numbers I want to get people underage drinking. It's like shooting fish in a barrel. But not to put their minds at ease that we're not coming after them. And we've had a few where there's been other substances found in their body where they're taking things recreationally. We don't necessarily criminally care about that. That's not why we're doing the testing. Now, if some of those substances are something that they could possibly have been spiked with, and that's the concern we have, but we're not going after the person reporting that they've been spiked. We're looking for the people who are spiking. So the officers are instructed to, try to put their concerns at ease. And we tell the providers also that that's not the purpose for us to take their sampling. At the same time, kind of explaining too, we need their consent for that before we can take it. So we also have to get their consent. So having a conversation with them about what that means and why we have to have their consent, and that and then who we would share the results with once we get them. They're all adults. They're the victim of a crime. We do not discuss any part of the case with their parents unless they want their parents to know about it. We have that discussion with them. Their parents can't call up here and go, I want to know what my kids, well, I'm sorry, it's an open active investigation. That you're not privy to that. Sorry for you. You'll have to have that conversation with your child. So that's between us and the victim or the reporting party. And we don't have those conversations with the parents. So I have not had yet, and I'm waiting for the day for a parent to call up here demanding for those results. I think that's because most of the folks that have reported to us have relayed the results to their parents. But I'm fully prepared to inform them that they're not privy to that information.
Yeah, I think that some of the challenges that we see with student populations around reporting, for situations like this are the same challenges we see out of them in being an active bystander, right? When others are in situations where they may need medical assistance as a result of either alcohol or drug use. We see a lot of barriers in the form of, I'm worried about what's going to happen to me. I'm worried about whether or not I'm going to get in trouble. I'm worried about who's going to find out and whether or not I'm going to have to answer for that. And Chief Campos and I are of like mind on this, and when our agencies know this, they've heard us both say this. The Clemson community, both in the city and the university, have heard us both say these things in public forums. We care about providing law enforcement services to people in need of law enforcement services more than we care about what were you doing that potentially we're going to find out as a result of this, right? Like, your underage drinking does not negate the fact that you're a victim or a potential victim of a crime. And if that's what you're coming to us for, that's what we care about, right? I can't promise people that there's not other activity associated with what took place that we don't have to do something about in the end of this, right? We don't have to have some type of follow-up or some sort of further action on, but that's not our principal aim. And we're very public about that. Our staffs are both pretty public about that when they talk to student groups and other organized assemblies of people. I mean, just 2 weeks ago, I was speaking to a class here on the campus. This class on well-being. And I gave that exact message, and I know I've heard many of my staff give that same message in other spaces, oftentimes when they didn't even know I was in the room. So I know they mean it, because they're not just saying it because for my benefit. But we absolutely care about trying to make sure that we take care of people. We help people get justice if they've been victimized to the best of our ability to do so. And from our perspective on the police side, being able to do this effectively and help overcome some of these barriers and some of these challenges is really about having a very trauma-informed or a very victim-informed approach to the law enforcement process, to the investigation, the initial report taking. It doesn't matter how well we do things on the back end, if a detective gets involved or the victim's advocate gets involved, if the initial reporting officer doesn't approach it from that lens, then we've lost the credibility or we've lost our ability to effectively engage with that person, and then feel like we actually care about that situation. So that's very important to us. I know it's important to the City of Clemson Police Department. We invest a lot of time in that. And I don't know for certain whether there's anybody from U of SC's police department on this call, but I know a bunch of folks with your law enforcement division, and they are outstanding people. And I know they do a wonderful job, and they are of like-minded approach in that concept as well. I did see my friend Stephen Burrett with Matt SC on the call, so great to have him on here. I know that Stephen and I have been in spaces together where we've he's heard me say similar things to other people. So that's really what we care about here, and the only way to overcome these challenges and these stigmas that people have involved, around getting involved with law enforcement, is to just be active with our communities of sharing that information, be a positive voice, trying to help them understand we are here for them. We are not here against them in any capacity, right?
Yeah, and I think from a university perspective, one way that we did that, and I know I've said it already, but those pictures, we put those pictures out in a newsletter to all of our students. Every student got it, and it's really unique to see your chief of police from the university and your chief of police from the city in line with these sorority women and partnering with them. And I would say that having that partnership with each of these chiefs has really helped already just show that care, and the way that they go about this has really been great as well. So just the last slide that I have here is just talking about different things that we've done, like training sessions that the RCMs have for, or RAs, I'm sorry, for maybe y'all, or Greek life and CUPD, coming and doing all of these things, and with athletics, kind of upping our communication in our trainings and being on the same page with each other, and having that consistent communication is super important as well. So I think, Jenna, I'm going to stop sharing so conversation can start, and somebody else can talk.
Great. Thank you all so much. That was super helpful. And I mean, I've got plenty of questions I can ask, but I would love to hear from other folks. I know we've had some other questions coming up throughout this process, so I want to have space for that first.
I have a question. So just for helpful context, my name is Ashley Cork. I oversee our interpersonal violence advocacy and prevention education office here at USC. I just want to make sure I understood like the process, at least what happens for the testing on campus or at your health center. So if a student comes and is like, "Hi, I'm concerned that my drink was spiked, or that I suspected that occurred recently, and I'd like to get a green screen, I'd like to get a test." Is the first like step they meet with that medical provider to like have that conversation? If the green screen that's what makes the most sense, law enforcement immediately is called, and then like that process occurs, the testing happens, or the collection, it gets sent out. Is that accurate?
Right. So chiefs also, but jump in. But the way that we've talked about it too is if they think that that is the case and they think that they are a victim of that, they call the police department in which the crime took place. So they're calling usually either the city or the university police. I think either would respond, but kind of making sure that they're getting it collected in the appropriate manner as well.
Okay.
Yeah,
So the law
so
enforcement's coming to campus, correct?
Yes.
yes, if they're having it collected there, yes. So it's important that we get the law enforcement agency that has jurisdiction of where the offense occurred to do the investigation. And we have a close working relationship because we're front porch neighbors with the university, that if the university officer responds, they're going to call us, we'll come over there and take it over, those kind of things. But we're also in a tri-county area. So the university is in Pickens County, but also borders Oconee County and Anderson County, and there's students that live in those different counties. So if they come to campus and they say, well, this happened out, there's a housing development called the Pier, that's in Oconee County. So they may reach out to the university police. The university police will determine, oh, wait, the Oconee County has to come. Then they'll call Oconee to come take a report. Worst comes to worst, we or they could take the initial report and we can just hand it over to that agency. But as far as the chain of custody, we just have to work through some of that. And we've reached out to those other agencies and they know about the green screen. So when that does get reported, they're not completely behind the eight ball, especially since the emergency room is at the Oconee County Medical Center in Oconee County. So if they go to the hospital for the treatment or they get transported to the hospital for the treatment, one of us is going to have to go out there or vice versa. So that will occur when it happens. But it's important that we take a report and we're doing an investigation. Sometimes this gets a little confusing because we have the non-report sexual assaults and law enforcement doesn't necessarily get involved on the front end. This can't happen that way. The law enforcement has to be involved on the front end to initiate the official investigation.
Okay. Thank you.
Do y'all have victim advocates on your campus, and like what role do they play in this process?
Yeah, so here in the police department, we do have a full-time law enforcement victim advocate, and that person certainly provides victim services to anyone that is a victim of a reported crime that we are investigating or is reported with our jurisdiction. But she also works as a liaison to help ensure that anybody we come in contact with, whether or not it's our report or not. So the example Chief Campos gave a minute ago about somebody presenting themselves to the student health center that may have had this happen to them in another jurisdiction, not the university police department's jurisdiction. Our victim service provider will help support ensuring that person gets appropriately connected with, if they're a student, certainly on-campus resources, the university's ability to provide them services. But she works very closely with all the victim service providers in our region. We have a really active group of law enforcement victim advocates in the upstate, and they work very hand in hand with each other, support each other. Because most of our agencies are what you consider small to medium-sized agencies in the upstate, right? We're not the size of the Columbia Police Department or Richland County Sheriff's Office. And so most of our victim service providers are all working hand in hand with each other to help support each other for that purpose. But Clemson's also got a group of interpersonal violence resource coordinators, and they are excellent partners with us in this and help provide services along that lines. And I know Kelley, you were going to say something as well. So anything else on that front?
No, I was going to ask you actually to talk about that a little bit more, but the only thing I'd add to that is the Office of Advocacy and Success partners with them as well. So they're a little bit separate from the interpersonal violence prevention coordinators, but take prevention out of that response. But that's part of if someone is to scan that QR code, they kind of come up as a resource for students, and they can help kind of connect across the board for university resources as well. One of those being the victim advocate that Chief Harrington's talking about, or other resources, maybe if they want to go to CAPS or should go to CAPS, and kind of suggesting that as well, or whatever that next step could be.
Thank you. And we had a question in the chat. Are faculty, staff, or graduate students on your campus, do they have access to the green screen testing on campus as well?
All citizens have access to green screen. The hurdle is how they're paying for the collection. So that's no different if it's a student or if it's a regular citizen, and where they're going to have it collected. So Anderson County is to our south. City of Anderson, the hospital down there is through the AvMed. We rolled this out to them, and they are interested in it as well. The sheriff's office is aware of the program. because they have citizens down there reporting that they're getting spiked in bars down there. So it's available to them as well. It's the same, and we've said this before, but it's the same evidence collection kit that we use for DUI investigations. So the green screen, and we didn't explain this earlier, the SASS Go came up with a great idea of packaging this kit with an information booklet and putting it in a green bag, and that's why it's called the green screen, for this particular type of crime. But the resources inside, aside from the booklet, is the same resources we use for other investigations. So that's covered. You're reporting that crime. It is a felony in the state of South Carolina to tamper with somebody's food or drink. That's a felony crime that we're investigating, and that's the kit we would use for evidence collection. So a very long explanation is, yes, everybody has access to this. It's just getting through the hurdles of who's going to do the collection, who's going to pay for the collection. Once it's collected, we take the kit, it goes to the lab, same as everything we just explained.
Yeah, what I would add on that is, at least on Clemson's front, I don't know how your health system's set up on the University of South Carolina's campus, but so Clemson Student Health Services, or Redfern, as everybody refers to it, that services students, not faculty and staff, although it does have a quasi relationship to occupational injury, first reporting and first assessment. But Clemson Rural Health also operates a health clinic and a primary care provider here on the university's campus that is open to faculty and staff. Kelley, you may or may not know, I don't recall specifically whether or not they can do collection. I know they give vaccinations there, and I think they do blood work collection there, but I don't know if they'll do sample collection. However, to Chief Campos's point, the reason why we didn't just provide these things to the Student Health Center, but we went out and partnered very purposefully with the local emergency departments in our area, is so that not only did they have access to the kits and they were available and readily there in the event a police officer from any of our jurisdictions had to go in the middle of the night and wasn't sure what to do, but the staff did know what to do. That was there. That resource was present. But if anybody showed up, any community member showed up and presented themselves and wanted to file a report with law enforcement for a suspected tampering or drink spiking issue, then that kit's there. The other beauty of the sample collection kit being the SLED sample collection kit is that we've got those kits in-house, and the hospitals typically keep those kits in-house because it's the same kit used for sample collections for DUI investigations. And so in the event an ED calls and says, hey, somebody's here reporting that they were the victim of a drink spiking situation in your jurisdiction, and they want to report that, an officer can go, and they don't actually have to have a green screen packaged kit. They don't have to have that at the emergency room. As long as the ER or the officers got one of those SLED sample collection kits, they can go and they can take that incident report, and the sample can be collected, chain of custody on the evidence can be preserved, and we can get that evidence submitted to the SLED laboratory. And so, again, a long explanation to say anybody who is reporting themselves to be a victim of this crime can get this testing done in conjunction with a law enforcement investigation. That's the key. Has to be in conjunction with law enforcement investigation for it to be submitted to the state crime lab.
I think to tag on just like a little bit too of something I kind of left out a little bit at the beginning. It was on the slide, but I didn't verbally say it. As part of the green screen kit is really promoting it to our students on the campus for their use. Again, like both chiefs have said, it's accessible to everyone, but we did purchase those kits up front. So we do have like a limited number of kits. We will obviously repurchase when that time comes, but that is a cost that our Panhellenic Council took on because that is something that they advocated for and really felt was necessary for the student safe experience and their wellness on our campus. And so our students are who fundraised and purchased those kits that have been distributed and really promoted to like their use and like their wellness and stuff like that, which is what makes the green screen kit so like unique and great for them, is having those Clemson resources specifically for them as well.
And I'll add, Ellie, we talked, and it's imperative that the student groups like the Panhellenic Council promote this, because Chris and I can talk to her blue in the face with the students, and it's going to go in one ear and out the other if they even hear it. But that it was very important that they got involved, they took ownership of it, and they promoted it, and they promoted it within their organizations as a solution to this. Otherwise, I don't think it would have gone as far as it had.
Yeah, and I just want to say I don't think we said this, or if we did, we kind of glossed over it earlier. But I just want to say thank you to Ellie and to the leadership and Clemson's Panhellenic Council, because very early on in this conversation that circulates every couple of years about rampant rumors of drink spiking, she engaged and reached out to both Chief Campos and I to come and speak to leadership in Panhellenic, because they had concerns and they were worried about this. And we got together, and it was in the winter. I remember it was in the winter because it started snowing while we were in that room. It was snowing while I was on the way home from that little session. But we got to spend some time and talk to them about what our concerns were and where we thought we could make some inroads and we needed their help. And really the question that came out of that is, what can we do? And then they really dove in and took ownership of kind of leading the charge on spreading the word, fundraising, and helping us get this off the ground. And so that's a piece of big importance to be successful with something like this. I mean, all of us who have been in higher education or been in a service provider or for law enforcement on call, like Chief Campos said, nobody cares what I think or what I have to say when we want to do something new. But you get some students behind it and you can accomplish a whole lot of things.
Well, thank you. That's such a positive message for us to be ending with. We did have one quick question. If you could just share how much each kit cost, just so we can get an idea of that before we wrap up.
Yeah, so the kits are $25 a piece. I did notice there was another question in the chat about the marketing strategy, and I think that covered it, but it did talk about the cup condoms, saying that those are fairly popular there, and that's great. I will say this, when we initially did our research through speaking with the students, and we got feedback from over 300 students, we kept noticing that when law enforcement would go and they'd review the video of particular students that believed that they had been drugged, they kept coming back and saying, Shannon, I can't find where their drink has been drugged. I've been looking. So I went back and I looked at the data that we had. And one of the questions that we had asked throughout that data was, what were you drinking at the time that the incident occurred? And when I looked back, 82% of the drinks that they were drinking included vodka. And we very quickly came to the realization that it may already be in the vodka when it's being poured. So I just want to say that while cup condoms can be very useful in a lot of situations, and we absolutely encourage any tool that somebody can use, you also want to make sure that people understand the signs when they have been drugged. And that's another thing with marketing, so that they can get their friends where they need to be pretty quickly in case the cup condom doesn't work and they need to utilize a green screen. So I just wanted to add that in.
Yeah, Ellie, so at Healthy Campus, we do not provide the cup condoms or anything like that. Ellie, I don't know from y'all's perspective if you want to share anything there.
Yeah, I mean, we still will pass them out at like tabling events or safety things. A lot of times our like councils for fraternity and sorority life, they will still put them in like wellness or safety kits and things like that. And I would agree, it's also really popular at the tabling event. I think students really like the idea of passing them out and they like the idea of taking them. But when we really dug deep asking the questions, when we really started these conversations, the women were saying, yeah, I'll grab them and I have a bunch sitting at home, but they're not actually utilizing them at the bars. It's not the cool thing to do. It's not the commonplace, as well as, a lot of them are now drinking things like beer or seltzers or things like that. And they're not always created to cover that. A lot of times they're created for drinks that have a straw or like a well style cup or things like that. And so they just weren't being used the way you would hope. And while they're a great prevention item to still continue to promote and pass out, if it wasn't used and students are still reporting drink spiking or, the feeling symptoms, things like that the next day, then regardless, the covers weren't doing anything, and we needed a second place of like, well, now that something has happened, what are our next steps after that? And so we still do pass them out. We don't push it as much as our only strategy anymore because we realize we have something more. And our students also started to feel a lot more safe knowing, if I felt this way, what are my next steps? Whereas before, they just didn't really feel like they had anything other than like, oh, this thing happened to me and now I'm just kind of stuck.
Yeah, I would just say Nikki Prade at USC, alcohol and other drug education. When we do hand those out, that it is not like a solo, like if you are safe for the rest of your life situation, it is always in tandem with that. Like, we love that you have this, but as friends in this group, what are we looking for? Like y'all said. So like, yeah, everything has something else in cahoots with it. Because there is that possibility that it's the bad actor could be even more of a trusted source of that bartender at the establishment. So what are we looking for? And to know like this is not the ideal outcome of any drinking situation in any amount. And so like when to act, because that's been a bigger thing for us the past couple of years. Is like people don't know that you should not be like this after any number of drinks. So let's not leave our friend. Like, let's do something. Let's respond, bystand, as we.
Thanks, Nikki. And thank you all so much. I do hate to cut this conversation short, but for our University of South Carolina, Columbia local people, we are planning to have another conversation about what green screens would actually look like on our campus to really start that action planning process. That meeting is going to be Friday, January 23rd. We're planning to do 12 to 3 p.m., a little bit of, lunch, networking, followed by a longer conversation about what we can do together to bring this program to our university and what steps we need to take to be able to effectively offer it, what kind of trainings would be needing for folks. We'll be starting to share that calendar invitation out to people. If you don't get it, feel free to reach out to me. I'll put my email in the chat, and we would love to have you all there. I'll have more information about that coming soon. But thank you so much, Kelley and your team, for your time today. This was a really incredibly valuable conversation. It's really great to hear how y'all were able to come together in this like such a unique partnership. And I'm really hopeful that we'll be able to implement something similar here at USC. So our next research series is going to be February 5th at 3:30 p.m. So we'll take January off from this meeting. We'll have our action planning meeting, and then we'll circle back in early February to continue with sharing research and programs on different campuses.
Thanks. I just want to also say that I said it at the beginning, but this wouldn't be a thing at all if it weren't for Brett and Shannon. So they're really their work is making all of this possible. So thanks, y'all.
Thank you very much.
Yeah, y'all are awesome. Great. Well, happy holidays, everybody. We'll see y'all in the new year.
Thank you. Bye.